Ambuvets Consult Nigeria Limited is a veterinary and livestock services enterprise founded in 2012 to solve the problem of access to quality animal health products and services, especially in remote, hard-to-reach communities of Nigeria.
Pest de petit ruminant, or PPR, is a highly fatal and contagious disease of sheep and goats. In the last 15 years, PPR has spread to more than 70 countries. It now threatens over 80% of the world's sheep and goats population. In Nigeria, it is responsible for a loss of 65 billion naira annually. Eradicating PPR could improve the lives of millions, especially in rural families who rely on sheep and goats production as a source of income and food. Over 70% of Nigerian poultry is reared as free range in rural households. However, Newcastle disease, an acute highly infectious disease of poultry that can cause up to 100% mortality in affected flock, continues to threaten the potentials of this subsector, causing economic losses because of high level of mortality, decreased production, and trading embargo.
Ina sayarwa in hidimana, ina kuma yankawa, in ni kyauta zai yi da su. To da dai kamin a fara rigakafi, ni kowane shekara ban taɓa yin shekara da awaki na ba su mutu ba. Za su haihu ba jaja, za su zo su haifi ƴaƴan su mutu, su riƙa yin zawo ko suna tare.
We realize that even though government have some of these policies around disease control, and vaccination is a globally accepted approach to controlling disease, however, we have not been able to translate this policy into implementation because of some of the obvious reasons like government funding, priorities, and the rest of it.
Interestingly, Ambuvets Consults have saddled the mission to support the Kaduna State government in developing a for-fee vaccination program for the PPR and NCD control. Kaduna, a destination state for many local and international investments, and one of the most rapidly growing states in the country. To foster economic sustainability, the state government drives, promotes, facilitates, and coordinates investments through private-public partnerships, privatization, and commercialization.
Kaduna State government is always improving. We are trailblazers, so we have recognized that fact. I think that's why in the first place we entered into these partnerships, not just with Ambuvets, like I said, with other private sector players, because government cannot do it alone. And our goal is always to have a sustainable plan. When we live here, we expect that the system would run itself and successfully too. So certainly when you see control of diseases, improvement in livelihoods of our citizens, and people even recognizing that they need to have a job to do or something meaningful to engage in economic activity, we see that they will have a brighter future, not just for the livestock subsector, but for the agricultural sector as a whole. And that's why we even made an economic activity, not a social service in Kaduna State.
Our ability to control PPR in the state would actually improve, would prevent losses and improve on production of this, and even the issue of international trade. We have PPR-free livestock. It means we can do business with foreign partners. So our livestock can be exported to foreign countries, which would mean generating more income as IGR either to the state or the nation. So if we're able by 2030, which is the global mandate, and we don't want Nigeria to lag behind, so Kaduna State is taking the lead by actually partnering with Ambuvets that they seem to have the skills, the expertise, and I think the coverage to help us to achieve that. So in terms of sustainability, the concept that Ambuvets brought that has to be is it fee for service or cost recovery is a very good one.
The Kaduna State Ministry of Agriculture has now adopted and endorsed a statewide fee-for-service vaccination strategy for the PPR and Newcastle. Through a well-coordinated market-driven model for vaccine distribution and delivery, the overall program goal is to improve the contribution of small ruminants and chicken to food security, nutrition, and economic growth in Kaduna State.
This innovation creates a chain whereby this vaccine is made available all the year to the veterinarian and the community animal health worker that works with the veterinarian to deliver this vaccine to the smallholder in his village. What this does is that the man does not have to go kilometers to be able to get somebody that will vaccinate his goat, his sheep, or his chicken. And in the process, the veterinarian earns some money, the community animal health worker earns some money, the farmer derives a benefit. So a value chain with monetary incentive is created, and that is what makes it sustainable.
Since the inception of the PPR and NCD control program, surprisingly, over 10,000 rural households in Kaduna State have been reached with PPR vaccination of small ruminants and Newcastle disease vaccination for rural chickens, reaching a record-breaking level of 51,000 small ruminants and 10,000 chickens vaccinated during 84 community-level vaccination campaigns.
My name is Master Ayuba Gaya, a community animal health worker working in Kurumisara, that is popularly known as Maraba Olijo, Kachia local government, Kaduna State. I specialize in vaccinating animals. I have been going from one Fulani place to another, try to vaccinate their sheep and goats and even chickens. So far, I have vaccinated sheep and goats 6,500.
The issue of cold chain. Ambuvets set up 4 additional offices across the state in Kafanchan, Zaria, Chukun, and Samunaka region of the state. And so each of these offices was equipped with a solar-powered refrigerator, just to ensure that the vaccines are always in cold chain, in good condition, and they are able to reach the farmers at that level. So we did not just invest in cold chain at the level of the offices. We installed 23 solar-powered refrigerators across the state, 1 per local government, and attached to 1 community animal health worker.
Apart from providing solar-powered refrigerators to community animal health workers to keep vaccine in cold chains, Ambuvets Consult also supported with motorcycles to ease delivery of vaccines and veterinary services to the last mile. Ambitiously, it has been the optimum goal for Ambuvets to demonstrate that farmers are willing to pay for vaccination services and other veterinary products. The success of this notable endeavor has led to more access to vaccination and veterinary products and services. This will vividly translate into healthier livestock, improved productivity, and more income for farmers, especially women who own the 70% of small livestock and chickens in the state.
Shekarar nan da na ba da aka yi rigakafi, gaskiya ni na gode ma Allah, ba akuya na da ta mutu, duk ga sunan sun haihu lafiyan Allah, ba matsala. Kaji ma da aka yi musu rigakafi, duk ga sunan suna kyankyasa. Masha Allahu Rabbi, mun gode. Kiya kuɗi kalila ɗan kaɗan ne muke bayarwa ana mana, tunda inda kuɗi ne wa yawa ba za mu iya bayarwa ba a matsalolin da muke samu akan kaji nan da awaki.
Through this approach of training and engaging community animal health workers and attaching them to veterinary officers to supervise them, we're able to generate a lot of data about livestock, small ruminant and chicken population in the state. So this area of data collection, there will be basis for government intervention or driving government policy, is one other benefit that we have been able to achieve.
Going forward, The state government and Ambuvet Consult will continue to upgrade the capacity of the community animal health workers and other paravets to provide community-level veterinary care under strict supervision by the state.
What government used to do on its own before, now government must be able to collaborate with other partners that can be able to deliver this service with a lean budget. And then you'll be reaching more people down there below the pyramid who are farmers, women with 2 goats. That might be the only investment, savings, assets that they have that can be wiped out by PPR.
Ambuvet relentlessly continues to identify and use this model to sustainably solve the gap problem of veterinary access in the state and across the entire country, using the lessons learned from a very successful implementation in Kaduna State to reach other states, helping them develop sustainable vaccination and animal health care delivery strategy driven by private sector investment.